Hi guys, welcome back to the channel. Lucy here with another video for you guys. So today we're going to be looking at Surgery Squad. I don't know what it is exactly. So basically we're doing virtual teeth whitening, which is basically, it shows us how your teeth gets whitened, and there's a whole range of games. So if you guys want me to play more of Surgery Squad, comment in that comment section below, like and subscribe and let me know. So let's just play this.
Welcome to Surgery Squad's virtual teeth whitening. I'm Dr. Susie, and I'll be
Dr.
guiding you through this
Susie
procedure today. You no longer have to be a supermodel or a movie star to have a dazzling white smile. Just about anyone nowadays can get one. A whiter smile looks healthy, plus it can improve your overall appearance and self-confidence. Our teeth become stained from coffee, tea, and other dark-colored liquids, and smoking certainly adds to the discoloration. A teeth whitening procedure can remove those stains caused by age and the things that we eat and drink.
It's crazy how we can do
There are a variety
that.
of ways to do it. A whitening toothpaste or rinse, over-the-counter strips and gels, tray-based whiteners, or in-office whitening performed by a dentist. While the most obvious benefit is a brighter, whiter smile,
Ancient Romans
you do need to
used
know that
urine
whitening is
to
not
whiten the
permanent.
teeth.
And a whitening program, whether you do it yourself or have it done by a dentist, might not always lead to the results you want. If you have the whitening performed by a dentist, your teeth need to be in pretty good condition. Your dentist will also want to fill any cavities or replace older fillings before the procedure. In addition, a dentist will not perform the procedure if your teeth have worn enamel.
Alright, sorry about that.
If you already have crowns or other restorations, the whitening will be inconsistent between those teeth and the others. Our patient today is a 27-year-old woman who has opted for an in-office dental whitening. She's a tremendous admirer of coffee, but she wants to impress the folks at her 10-year class reunion with a bright, white smile.
Ooh.
So let's scrub up, glove up, and help her out. Our hygienist has already cleaned her teeth to remove all of the
She got
plaque.
like a tash.
So let's start by
Well, a
matching our
beard.
patient's current tooth shade with one from our shade reference guide.
Probably that one.
Okay, we've got our starting shade. Let's see if we can make them more like this. First, protect her lips and tongue by covering them with these rubber guards.
So I probably won't talk much in this
Nice
video
work.
just because she's
Now we
talking.
need to cover her gums and papilla, which are the tips of her gums between her teeth, with a special coating to protect them from the risk of chemical burns when we use the bleaching agent. Now, let's mix up our bleaching agent. We'll use carbamide peroxide, which is a powerful, reddish-looking substance. It turns into a stronger form of hydrogen peroxide in the mouth once we clean it off with water.
Oh,
That's when it takes off the stains. The mixture is ready, so let's get it onto her teeth.
that sounds
Cover
painful.
each tooth evenly.
So you just have to spam this. I don't know why it's red. Let's go and press continue. On the bottom too. I'm just gonna do one tooth. It does take quite a while, so I'm just gonna press
Keep this
continue.
solution on her teeth for about a half an hour.
30 minutes later.
Let's see what kind of beautiful smiles underneath all of this red stuff. Take some water and gently wash away the carbamide peroxide.
Alright, so it's pretty white under there. Like, I wonder if that actually, like, works like that. So I'm just going to press continue because that's going to take like half an hour to do each tooth.
Now with our dental
Whoa,
pick, simply pop
that
the
is a
protective coating
lot
from her gums.
of white teeth. Considering like how yellow they were before, I wonder if that actually works like that. But that looks so good. Whoa.
Great work. I'll take off the rubber lip and tongue protectors and see you back out in the waiting room. She's really gonna knock 'em dead with that bright smile of hers at her class reunion.
That's
But for
like
now,
such
her
a
teeth
difference.
will probably be sensitive for a few days. She should avoid extremely hot or cold beverages for the rest of the day and use a toothpaste made for sensitive teeth for a couple of weeks. She should also, as much as possible, avoid discoloring beverages like coffee, colas, or red wine for a few days. If she smokes, well, now would be a perfect time to stop. This bleaching will most likely last for 2 or 3 years, so
What?
she'll want to make this an
2 or
ongoing part of
3
her overall
years?
dental care. She should call her dentist if she feels a burning sensation in her gums or on her teeth that lasts for a couple of days, or if her teeth remain highly sensitive. You did a fantastic job today. While you're here, try your hand at one of our other surgeries available at surgerysquad.com.
Alright, I think we're going to do one more, which will be the virtual laser tattoo removal. I think we'll do that, and then, because we haven't really done enough for a full video yet, so let me just set this up. Alright, so we've got the Roland Dead Bones, or whatever, the tattoo. So I'll have to just sort the audio and we'll be right back. Alright, that's a lot better, so it looks like we've got Dr. Susie
Squad's
again.
Laser tattoo removal. I'm Dr. Susie, and I'll be assisting you with this procedure
Hey,
today.
how you doing, Susie?
According to a recent poll, over 50% of those with tattoos want at least one removed.
Whoa.
They cited being too young when they got it, a new career, or significant life changes, such as divorce or childbirth, as reasons why they no longer want them. Luckily, there's laser tattoo removal. Laser tattoo removal is a procedure that uses a powerful
I just,
laser
like,
that
whacked my
reacts with the
elbow.
ink of a tattoo to break it down into tiny particles. The laser directly targets the tattoo pigment and leaves the surrounding skin virtually untouched.
Whoa.
After the ink is broken down, it is removed by the body's immune system, creating a natural-looking fade that typically only time or sun exposure would produce. Although laser tattoo removal is considered highly effective after multiple treatments, those interested need to keep in mind that yellow, green, and fluorescent tattoo inks are much more difficult to fade.
That's well good. After
Our
10
patient
treatments,
today
it's
is a
completely
male in
gone.
his mid-20s that got a tattoo on his calf when he was a teenager. Now that he's older, he doesn't see the tattoo as being so attractive anymore. In fact, he's come to us to get it removed. So let's scrub in and see what we can do for him. Before we begin, we need to go back in time to the day he picked out his tattoo. Help him pick out a real winner. Use the arrows to scroll through the tattoos. Click
Oh,
choose
that
when you
one's a
have made up
bad
your
one.
mind.
I think I'm gonna pick the baby one. That one's the worst. I'd hate to have that tattooed on my leg.
Yikes! She doesn't really look like that, does she? Let's make that tattoo disappear.
Oh,
During
that's
the
well
patient's initial
timed.
consultation, it was recommended that he take a non-aspirin pain medication prior to the procedure to reduce any discomfort he may experience. Other than that, there really isn't any other preparation needed. So let's get started. A lot of patients describe the pain from the laser as feeling like 100 rubber bands striking the skin at the same time. So to begin the procedure, we'll need to place a cold compress on the tattoo for a few seconds. This will help reduce the pain caused by the laser. Go ahead and place the cold compress.
Alright, like I said, I won't be talking as much in these type of episodes
That will
just
do.
because
Now we need to use the laser to fade the tattoo.
they talk quite a
Different
bit.
types of lasers react with certain colors of tattoo ink. One laser might work perfectly for reds and oranges, but not so great on greens or black. So we'll use a variety of lasers to get the desired result. To help relieve some of the pain associated with the procedure, we'll also use a machine that blows icy cold air on the area being treated. Let's start by targeting any red or orange ink areas.
Oh, cool. So, I wonder what happens if we target a black. Oh, it doesn't do anything. I wonder who Princess Beth is. I think it were a bit tight that she said, yeah, she doesn't really look like that, does she? There we go.
Next up is green, blue, or other darker colors.
So we need all of this. It kind of looks like he got it burnt. And I know laser treatment's like burning it off, like you burn it off. Cause it like melts them down. Alright.
Finally, we'll remove the black.
Yeah, the black. This tattoo's gonna look very, very horrible. It's gonna look even worse than it already did when it looks like once after the first treatment. But I've got some others for... I've got some other Surgery Squad coming out pretty soon. Well, I'm planning them to be coming out. I'll see how this one goes. If it doesn't go very well, I will upload it, but I'll see.
Now that we've completed the first treatment, we'll need to place the cold compress on the treatment area to relieve some.
That looks painful. Who's Jeff? It
You
says
did great.
Jeff.
Our patient is ready to go. Immediately after each treatment, the tattoo may feel sunburned, and it is extremely
Ooh,
important
that'd
to keep it
hurt
covered
so
until
bad.
it heals. If our patient fails to do this, both his recovery and the results of the treatments may be negatively affected. Roll the bandage over the treated area.
Here we go.
As stated earlier, our patient's tattoo will only begin to fade after multiple treatments, so he shouldn't expect the tattoo to go away during one session.
Alright, let's carry on.
Completely removed, it should be lighter and much less visible than before. And that's laser tattoo removal. Well done! Why not try your surgical skills in another surgery?